and welcome to Medical Dialogues Journal Club, your daily dose of health and medical news. I'm Dr. Priyanka Ahuja, and today I'm going to talk about maternal and perinatal outcomes of SARS-CoV-2 infection during pregnancy. SARS-CoV-2 infection during pregnancy may be significantly associated with an increased risk of adverse maternal outcomes, that is, disease requiring hospitalization, admission to an intensive care unit or critical care unit, and/or oxygen therapy. A recent study published in JAMA Network has indicated. The study was conducted by Elizabeth McClymont et al. The authors looked at Canadian surveillance of COVID-19 in pregnancy, Can COVID Preg, the national surveillance program for SARS-CoV-2 affected pregnancies in Canada. The analysis presented exploratory population-level data from 6 Canadian provinces from the period of 1st of March 2020 to October 31st, 2021. A total of 6,012 pregnant persons with a positive SARS-CoV-2 polymerase chain reaction test result at any time in pregnancy were included and compared with 2 contemporaneous groups including age-matched female individuals with SARS-CoV-2 and unaffected pregnant persons from the pandemic time period. Among 6,012 pregnancies with complete information about a SARS-CoV-2 related hospitalization or ICU admission, 466, that is 7.75%, had hospitalization. 207, that is 3.4%, required oxygen therapy. 121, that is 2.01%, had an ICU admission. When compared with female individuals aged 20 to 49 years in Canada diagnosed with SARS-CoV-2, patients with SARS-CoV-2 during pregnancy were at a significantly increased risk of hospitalization. None of the patients who had received at least 2 doses of SARS-CoV-2 vaccines experienced any of the adverse maternal outcomes. With their analysis, the authors noted the following. Among pregnant SARS-CoV-2 positive individuals, increasing age was associated with a significantly increased risk of ICU admission. The presence of pre-existing hypertension resulted in a significantly increased risk of requiring oxygen therapy. Greater gestational age at diagnosis was associated with a significantly greater risk of hospitalization and oxygen therapy. Among infections diagnosed at 28 weeks gestation or greater versus infections diagnosed at 15 to 27 weeks gestation. Body mass index, type 1 or type 2 diabetes, asthma, and race and ethnicity were also significantly associated with an increased risk of adverse maternal outcomes. The median length of hospital stay was 6 days. The median length of ICU stay was 4 days. The median time between hospital admission and delivery was 34 days. Rates of preeclampsia, cesarean delivery, and stillbirth did not differ significantly between SARS-CoV-2 affected and unaffected pregnancies in Canada. The rate of overall preterm birth among SARS-CoV-2 affected pregnancies was 11.1% compared with 6.8% among all unaffected Canadian pregnancies. Of the 175 preterm births with detailed delivery information, 46% were spontaneous and 54% were medically indicated. Preterm birth occurred at an elevated rate even in cases of mild diseases not requiring hospitalization. The authors wrote, unlike other studies that have solely relied on the identification of infection at delivery and missed cases that resolved during pregnancy, this study captured SARS-CoV-2 infections throughout gestation. Additionally, this analysis was able to compare cumulative incidence of pregnancy and birth outcomes from a comprehensive cohort of SARS-CoV-2 affected pregnancies with national level data on all pregnancies to quantify the differential risks of pregnancy outcomes associated with SARS-CoV-2. In this exploratory surveillance study conducted in Canada from March 2020 to October 2021, SARS-CoV-2 infection during pregnancy was significantly associated with increased risk of adverse maternal outcomes and preterm birth, they concluded. That's all for today. Stay tuned to Medical Dialogues for further updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.